Hey everyone, welcome back to the channel. Have you ever felt your heart skip a beat, race unexpectedly, or flutter in your chest? You're not alone. Millions of people experience irregular heartbeats, and in recent years, an unexpected remedy has gained serious scientific attention: meditation. But can something as simple as sitting quietly and breathing really affect your heart rhythm? Today, we're diving deep into what science actually says about meditation and irregular heartbeats. Stick around because some of these findings might surprise you. Understanding irregular heartbeats. First, let's talk about what we mean by irregular heartbeat. The medical term is arrhythmia, and it refers to any deviation from the normal rhythm of your heart. Your heart is supposed to beat in a steady, coordinated pattern, typically between 60 and 100 beats per minute when you're at rest. But sometimes, things go off script. You might experience atrial fibrillation, where the upper chambers of your heart quiver instead of beating effectively, or premature ventricular contractions, where your heart seems to skip a beat. Some people experience tachycardia, where the heart races too fast, while others deal with bradycardia, where it beats too slowly. Now, here's what's crucial to understand. Not all irregular heartbeats are dangerous. Many people experience occasional palpitations that are completely harmless. However, some arrhythmias can increase your risk of stroke, heart failure, or other serious complications. That's why it's essential to work with a healthcare provider if you're experiencing heart rhythm issues. The question we're exploring today isn't whether meditation replaces medical treatment. It's whether it can be a valuable complementary tool in managing certain types of irregular heartbeats. The stress-heart connection. To understand how meditation might help, we need to talk about stress. Your heart doesn't beat in isolation. It's constantly being influenced by your autonomic nervous system, which has two main branches: the sympathetic nervous system, your fight or flight response, and the parasympathetic nervous system, your rest and digest mode. When you're stressed, anxious, or overwhelmed, your sympathetic nervous system kicks into high gear. Your body releases stress hormones like cortisol and adrenaline. Your blood pressure rises, your breathing quickens, and yes, your heart rate increases and can become irregular. Chronic stress is particularly problematic. Research has consistently shown that people under prolonged stress have higher rates of atrial fibrillation and other arrhythmias. A study published in the Journal of the American College of Cardiology found that psychological stress was independently associated with increased risk of developing atrial fibrillation. This is where meditation enters the picture. Meditation is essentially training for your parasympathetic nervous system. It activates that rest and digest mode, counteracting many of the physiological effects of stress. What the research shows. So what does the actual science say? Let's look at some compelling research. A landmark study published in the Journal of Arrhythmia examined patients with paroxysmal atrial fibrillation. That's the kind that comes and goes. Participants who practiced meditation and yoga showed significant reductions in both symptomatic and asymptomatic arrhythmia episodes. We're talking about a 50% reduction in symptomatic episodes and a meaningful decrease in anxiety and depression scores. Another fascinating study from the University of Kansas Hospital looked at patients with heart failure, a condition often accompanied by arrhythmias. Those who practiced meditation showed improved heart rate variability. Now, heart rate variability is a key marker of cardiac health. It measures the variation in time between heartbeats, and higher variability generally indicates a healthier, more adaptable cardiovascular system. Research from Harvard Medical School demonstrated that mindfulness meditation can actually change the brain regions associated with stress regulation. MRI scans showed increased gray matter density in areas responsible for emotional regulation and decreased density in the amygdala, the brain's fear center. These structural changes translate to real physiological effects, including better heart rhythm regulation. A meta-analysis examining multiple studies found that meditation practices consistently reduced heart rate and blood pressure, while improving overall cardiovascular function. The effects were most pronounced in people who maintained a regular practice over several months. Perhaps most intriguing is research showing that meditation can reduce inflammation in the body. Chronic inflammation is a known trigger for atrial fibrillation and other cardiac issues. By lowering inflammatory markers, meditation may address one of the root causes of irregular heartbeats. How meditation actually works. But how exactly does sitting and breathing create these changes? There are several mechanisms at play. First, meditation directly activates the vagus nerve, which is the primary nerve of your parasympathetic nervous system. When the vagus nerve is stimulated, it releases acetylcholine, a neurotransmitter that slows your heart rate and helps regulate rhythm. Second, meditation reduces the production of stress hormones. Lower cortisol and adrenaline means less stimulation of your heart, allowing it to maintain its natural, steady rhythm. Third, meditation improves something called baroreflex sensitivity. Your baroreceptors are sensors in your blood vessels that help regulate blood pressure and heart rate. Better baroreflex function means your body can more effectively adjust to changes and maintain cardiovascular stability. Fourth, regular meditation practice improves your overall stress resilience. You become better at recognizing stress in your body and responding to it before it escalates into a full-blown physiological response that might trigger an arrhythmia. Finally, meditation enhances body awareness. Many people with arrhythmias develop anxiety about their heartbeat, which ironically can trigger more episodes. Meditation helps you observe these sensations without panic, breaking that vicious cycle. Practical application. So if you're dealing with irregular heartbeats, how can you actually use meditation? Here are some practical guidelines based on the research. Start with just 5 to 10 minutes daily. Consistency matters more than duration. The studies showing benefits typically involve people practicing at least several times per week for several months. Focus on breath-centered meditation. Research suggests that practices emphasizing slow, deep breathing are particularly effective for heart rhythm regulation. Try breathing in for 4 counts, holding for 4, and exhaling for 6. That longer exhale specifically activates your parasympathetic nervous system. Consider guided meditations designed for heart health. Many apps and online resources offer meditations specifically focused on cardiovascular wellness. Be patient. The structural and physiological changes from meditation don't happen overnight. Most studies showing significant benefits involved practice periods of 8 to 12 weeks or longer. Track your progress. Keep a journal noting your meditation practice and any changes in your symptoms. This can help you and your healthcare provider assess whether meditation is beneficial for your specific situation. And crucially, view meditation as complementary to medical care, not a replacement. If you have a diagnosed arrhythmia, continue working with your cardiologist while adding meditation to your treatment plan. So, can meditation really fix an irregular heartbeat? The science says it depends on what we mean by fix. Meditation isn't a cure, and it won't eliminate all arrhythmias. But the research clearly shows it can be a powerful tool for reducing episodes, managing symptoms, and improving overall heart health. By reducing stress, activating your parasympathetic nervous system, and improving your body's regulatory systems, meditation addresses some of the underlying factors that contribute to irregular heartbeats. For many people, it can mean fewer episodes, less anxiety, and better quality of life. If you found this video helpful, please give it a thumbs up and subscribe for more science-based health content. Have you tried meditation for heart health? Share your experience in the comments below. Thanks for watching and take care of that amazing heart of yours.